Great. Thank you for joining this session titled Fireside Chat, Using the Digital Front Door to Inform Decision-Making and Deployment of Care Resources. My name is Paige Heafy, and I'm the Chief Integration Officer for Giant. And joining me today is Tracy Donegan, Chief Information and Innovation Officer at MLK Community Healthcare. Welcome, Tracy. I'm happy to have you here.
Thank you for having me today.
So Tracy, let's start off by having you give a little bit of an introduction about yourself and about MLK Community Healthcare.
Sure. Again, my name is Tracy Donegan. I am the Chief Information and Innovation Officer at MLK Community Healthcare. I've been in the industry about 25 years. I know it's hard to believe, but in and out of consulting and leadership roles in the industry. I was VP of Strategy Management at Apria Healthcare when I heard about a Greenfield Hospital being built up from scratch, and that was MLK. So I joined that team in 2012, and we opened up the hospital in 2015. We are a 131-bed nonprofit standalone community hospital with a multi-specialty group and 3 clinics. We serve about 1.3 million residents in South LA and really the most vulnerable population in LA County. We have a long history of access issues to primary and specialty care. In fact, most of our service area is labeled as a health provider shortage area, which means we're short about 1,200 physicians. So you can only imagine how hard it is for residents to get the care that they need. And that's resulted in our residents having seriously progressed chronic diseases. And when you can't get or have access to a physician and you have an acute episode, your first point of entry is typically the emergency room.
Sure. So you have certainly unique challenges within the community. And then over the last year, complicated further with COVID. In your unique role, you attempted to bring some tools, some digital tools to help address some of those issues. Can you talk to me a little bit about your digital front door that you have now affectionately named Mia?
Yes. Well, Mia was wonderful. As I mentioned before, we had 2 big problems when I first met Giant a few years ago. That was we had a real problem with overcrowding in our ED, and then also no-shows, a significant number of no-shows in our clinics. So with our ED, our capacity when we built the hospital was only built for about 45,000 encounters a year, and we had 110,000. It was just crazy. With no shows, it was just a significant number. And as I mentioned before, the residents, have real issues or problems accessing medical care for a variety of reasons, and they end up showing up at our ED just because it's convenient for them. About 42% of our visits are non-urgent or less urgent types that could easily be helped if they had immediate access to a tool like Mia that could help them triage their symptoms. So really the reason why we chose Giant and Mia was because to give our residents just access to answers and to help them navigate the system.
Interesting. How did Mia help your hospital respond to the pandemic?
Well, for a variety of reasons. One is that you remember at the time at the beginning of the pandemic, there was all this misinformation. And I think Mia helped clear it up. I mean, it helped give very clear, accurate, up-to-date answers on the virus itself and how you get it, how you protect yourself. The other thing that Mia did was it helped the patients or our users stay safely at home when they had a symptoms or they thought they were exposed. They could easily get on to Mia and try to dialogue what they were feeling or how they were feeling. And then Mia, based on their answers, would direct them to the appropriate venue. But then, as I mentioned before, capacity is such a big issue for a hospital. And that was one of the big things that we had to make sure that we did, was make sure we ensured we had the capacity to accommodate any volume of COVID patients or suspected COVID patients as they walked in the door. And that was a big deal for us.
Sure. As it was with every hospital across the nation
Yes.
at the time, right?
Yes.
So you implemented Mia to be able to help, be kind of a frontline form of defense, if we call it that, to help offer information to your community, help them with some initial navigation of COVID type symptoms, or later down the line about even wanting to find out about vaccine availability. Having a digital front door that helped answer some basic FAQs and provide some basic information to your community, how did it then help you better manage your resources during that time when you were being bombarded?
Yeah, I mean, I think resources in terms of space and people, really. Two big things: call center and our switchboard operator in the hospital. Like I mentioned before, there was a lot of questions and around COVID and misinformation. So our call center and our switchboard operator was just getting bombarded with calls, and we had to have a way to manage that volume and redirect people to actually a easier way to get information. The other thing too is, I don't know if you remember, but hospitals really shut off any types of visitation. So if you've ever had a loved one in the hospital, you want to know how they're doing like every minute of the day. So we wanted to make sure our phone lines were open for that kind of access to information about people's loved ones.
Yes.
Yeah, and the other one was definitely preserving the capacity, which was so important. I don't know if you realize, but our hospital was the epicenter of the epicenter in LA. We had the highest number of patients for most of the hospitals, and the highest percentage of patients that had COVID. For example, at the height of the pandemic, 120% of our patients, of our licensed beds, were COVID patients. I mean, we had beds everywhere, in the gift shop, in the hallways, in conference rooms. So it was just urgent that we had a way to keep patients that didn't need to go to the hospital away from the hospital.
Yes, I remember seeing those news stories. It was just heartbreaking and devastating. But now fast forward, 6-9 months later, you've come out of it and the other end and starting to look forward.
Yes, and
what you can do next.
Yeah, and we were really successful in managing through it. I mean, we've got the right resources, the right help from the community. I mean, it was all hands on deck. I even had my own team that were clinicians, serving patients at that time. So it's a good success story.
That's wonderful.
Yeah.
So now looking forward, you started with Mia during COVID to help address some of those immediate urgent needs that you had, and wanted to find multiple ways to offer resources to your communities. Now, as you transition past that, what are some additional use cases for Mia that you are now pursuing and thinking about?
Well, first, I just want to say, I mean, the technology giant, the chatbot is just a wonderful, very flexible technology, and I really think could really serve as a true digital front door. I mean, so when I'm answering the question, I'm really talking about different ways to open up avenues for transacting with our system or accessing care. Number one, telemedicine. When we implement the full front door, actually, I think it went live today. The endpoints really for those that need urgent care at that minute is going to be telemedicine, on-demand telemedicine. So we hope to improve access to healthcare with that. But also there are going to be times where, there could be some asynchronous telemedicine. They just need a prescription. They don't need to talk to a doctor. So we can open up different capabilities like that. And I think with Giant, it's going to be easy to do. And I know you've done that with others. So I don't think we're new to the functionality for that. Other things is for our call center. I mean, managing the volume. It's not like we're a huge hospital. We've got this humongous call center ready. We only have a certain number of agents and a certain amount of time. So we need a way to be able to provide answers to questions. We need a way for patients calling in. They don't want to wait. They can be redirected to Mia. So it all offers all kinds of access and ease and efficiency when dealing with the users. The other way we could implement more functionality with Mia is being able to engage better, or have a way to engage with our patients after they discharge from the hospital, or if they're in the throes of a disease management program, we can reach out to them at any time, send them a link to a questionnaire, have the answers be sent to some sort of team that will respond to them. I just feel like the possibilities are endless. And that's what really attracted me to Giant to begin with, is the flexibility of the tool itself.
Yeah, you certainly have a big picture of how you want to use it in all sorts of different ways to reach out and keep your patients engaged with MLK Community Healthcare. Speaking about the flexibility, your MLK Community Healthcare is in a community that is predominantly Latino and African American. And in the past year, we saw that 1 out of 5 users actually engaged with Mia in Spanish, because we have that flexibility of offering the front door in different languages. So that was actually really interesting to see that your community was actually taking advantage of using it in their native language.
Yeah.
Yeah. Related to that, and beyond just collecting the information about usage in different languages, in what other ways did the data gathered by the digital front door inform your decision making?
Well, I think, at the time, the data we've been collecting primarily has been from the COVID tool. And it was really interesting to see the number of people reporting symptoms and exposures and the lag between those as compared to LA County. And it was really interesting to see the relationship. And also it helped us sort of predict when we thought we were going to have a surge, and that was very helpful from that perspective too. But I think as we gain more functionality in Mia and we actually dedicate the resources, we need to look back and see what type of information, questions, usage of Mia, so we can keep on perfecting it. Helping the users engage with it. Maybe the questions aren't worded a certain way, or the flow isn't quite right. So it's not one of those tools that's a one and done. I mean, you really have to use it as a tool to gain insight in the community and to help them get access to our services.
Right. I mean, to your point, there is the ability to take the data that we get about the questions your consumers are asking and what are the topics that they're looking for and trying to find information on, that we can actually work with you to provide those data and analytics, so that way you can continue to improve Mia to make it more responsive and meet the needs of your community. So that is actually one of the fun things that we enjoy partnering with clients like you, to be able to continue to build and improve for you, particularly Mia, for your community.
Well,
So,
I also want to add too, if I may, I mean, MIA is not just a tool for our community, it's really an extension of our resources. You know, again, it's our
better
front
said.
door.
That is
And
correct. Better said than I said.
yeah, I mean, so it really provides sort of the front end to our administrative resources and could really help leverage and extend their time so that Mia could answer some of the more routine, mundane questions. And then that helps us more time for our resources to really help problem solve live with our users.
So then what do you see as a role for Mia 1 year today? What are some of those key problems you'd really like for her to be solving and alleviating your administrative team from?
Yeah, I really look at it in terms of functionality that I want to add, first of all. So we've got telemedicine right now. I think it's linked to our on-demand telemedicine platform. But also I'd like to add some more integration with tools that we're implementing for provider search and appointment scheduling. The integration with Cerner also would help tremendously. So we look at that. Pre-appointment tasks, form filling, signature, all that integration with those tools, I think would be really helpful for our staff. And then the information being integrated to the EHR. So once the patient shows up at the clinic, everything is in the medical record, and there isn't much for checking them in, or even Mia could be used to check them in as well. And I think as we start to develop more disease management programs, more remote monitoring, and other engagement tools, I think Mia would help with all of that as well. As I mentioned before, being able to, help them answer questions when they leave the hospital once they're discharged, or request prescriptions. There's just, like I said, a myriad of things that I think Mia could do for us in the future.
Wow, you have a really bold plan of what you want to get accomplished in the next year. And I look
Oh,
forward
that's
to
a year from now.
Yeah,
You're right.
yeah, exactly. That's okay. So you want to accomplish it in a year. Maybe it will take 2, but we'll try to partner with you to roll it out as quickly as you possibly can. And as your community wants to take advantage of it. So
That's true.
but related to the community and your community taking advantage of digital tools, thinking about that larger issue of increasing access to care. How are you approaching the adoption and utilization of digital solutions within your community?
Well, I think it comes down to 4 things. One, they got to have access to some sort of technology or broadband smartphone to use it. We got to give it in a language that is their native language. They need to understand how to use it. And then lastly, I feel that they need to have trust that they're actually going to, get the goal of whatever they need to do with Mia accomplished at that time, and things are going to be taken care of, like, for example, requesting an appointment. So all of those ways uncover a lot of different initiatives and research that we need to do to help with the process.
Fantastic. And then again, talking about one of the kind of big topics that is front and center of everyone's mind in healthcare right now. How does your work, including Mia, help MLK Community Healthcare address the broader issue of health equity?
Well, I think you could look at it in 2 different ways. One, I mean, technology could actually level the playing field for, equity, health equity in general, but it also could play against it. So, and as I talked about before, having access to the right tools, the broadbands, the smartphones, I mean, that is one way that we could tease out removing some of the barriers to that, but also educating users on how to use it is not specific only to our community. It's all over the place.
Right.
So really coming up with strategies on how to reach the patient or the user, how to educate them, that's going to be a challenge. And I hope my team could help identify ways in which we could do it. I just, as a case in point, I shadowed one of our physicians on Friday, and he had like 2 or 3 telemedicine calls as I was in there, and 2 out of the 4 were successful. The other 2, they couldn't get the volume on, the camera didn't work. And some of those problems, you don't really know what the root cause at that moment. And it could be just the technology, or it could be, the patient's understanding of how to use it. At this point, you don't really know. You have to parse those things out and really do the research.
Certainly. And even though recent data from the Pew Research, it shows that, every year more and more people have a smartphone. I think the most recent number I saw was, 85% of the total US population, actually has a smartphone nowadays. It still doesn't mean that it works perfectly, right? And to your point, you have to have broadband access, or you have to have a good cell reception, area. Then, you have to be able to know how to use it. And if there's a different telemedicine platform that needs to connect with it somehow, you have to be able to, know how to either get into or log into or access the telemedicine platform as well. So you're right, there are a lot of complexities around it. Over the last year, I think we learned a lot, right?
Right.
We all learned a lot. Everyone had to ramp that up quickly. And
yes.
you and your team had to do it as well. So can you tell us a little bit though about what you saw, kind of as we wrap up with the last question? Can you tell us a little bit what you saw with regards to adoption and your community being willing to use telemedicine or other ways of accessing care or getting visits with providers that wasn't in person?
Yeah, I think the adoption was pretty well, only because it was so necessary. People didn't have a choice, and typically when you implement these technologies, one of the resistors really is the people that are actually the physicians and the clinical team, and there was absolutely no resistance from them at all. I mean, they really took to it. So that was very important too. But I think the barrier still is understanding the system in general. I guess just going back to your Pew Research, 75% of those people that have access to that don't have access to smartphones are those that don't have high school or under education. And in our neighborhood, 43% of those people have less than 9th grade education. So I think we have, a real challenge ahead of us to, really describe how to use it. A lot of health systems are hiring what they're calling digital ambassadors, which I think is probably something we need to look into.
Yeah, thank you for that extra piece of information to help us get a better understanding of your community and some of the challenges that you're up against. At the same time, knowing who you are as a leader and the rest of the leadership team at Martin Luther King Community Healthcare, I know all of you are very capable of being able to identify and solve each and every one of those challenges in order to be able to increase access to care for your community. So we are close to our time for this session. Is there any final comments that you would like to offer to the audience?
Well, this might sound a little cheesy, but I absolutely love working with Giant. I have to say, we've had some problems, like challenges, particularly with our call center. And I just, call you and I say, look, we're having this problem. And then, later that night, I'll receive some sort of flow chart diagram on how it can be solved using Mia. So it's just such a pleasure working with you, and you're such a good partner. Thank you.
Well, thank you to you too. We feel the same, and we look forward to continuing our work with you. So thank you for participating today and for sharing your story and the story of Martin Luther King Community Healthcare and how they're using a digital front door that named Mia to help address some of their access issues. It's been a pleasure talking with you.
Same here. Thank you, Paige.
Take care.